Hello, women in midlife. Today, I am very honored to have this gentleman here. His name is Dr. Dicky Ng, and very hard to get him, and he has given a bit of his time to talk to us. So don't go anywhere. Good evening, Dr. Dicky. How are you?
Hi, Karen. I'm good.
Good, thank you. Before we start, maybe you can introduce yourself to the audience.
Hi, I'm Dr. Dicky Ng. I work in Adventist Hospital in the wellness clinic. I have been there for close to 30 years. I am an occupational health doctor and also a lifestyle medicine doctor. Besides working in wellness center, I also like to do community service project like working with a doctor. The Penang chapter is called Just Walk Penang, and also the Diabetes Malaysia Penang branch.
Wow.
These are all my hobby.
Wow. Okay. So your days are very full, I reckon.
But I love this kind of work because my philosophy is to empower people so that they understand their health condition, or they understand how to take care of their health so that they can have a good quality life.
Exactly. Okay, so that's the reason I wanted to invited you here to talk to the audience. So as you know, my channel is predominantly about menopause women, and I just want your take from a doctor's perspective. Some of the things, what are the signs that women should look out for at perimenopause and menopause level?
When a woman come to perimenopausal time period, that is usually way after 40s. Right. The average age in Malaysia getting into menopause is between 48 and 52, where your period begin to change quite rapidly. But of course, after 40s, actually generally most women, their period would begin to become less and less, right? So the common symptoms is period, the quantity, the amount change, even the regularity change. Right. And then when you come to really the menopause, close to menopause time, you can have hot flashes, you can have night sweat, you can get chills, you can have sleep problem, mood changes. Some people metabolism changes too. They can have some weight gain. They can have vaginal dryness. These are the major issues that face by women when they come to the perimenopausal and menopausal period.
Right, and there are also to some extent even very the formication where the skin is very dry and they are scratchy and
yes,
and joint pains, which I had actually. It was like suddenly it just came and I didn't know what was wrong. Why am I having a lot of joint pains as well? And in this situation, let's say someone comes to you and they ask about, because they're uncertain. A lot of women don't even realize, because when you're in your 40s, you are kind of, most women will be building their career and they're very busy at work or dealing with young children or teenagers, which is a challenge in itself. So a lot of them actually overlook their health. And what are some of the things that they can do in terms of checking if they are actually going through menopause?
If they are not too troubled by it, you can let it naturally go, because when the period is totally stopped for 12 months, they actually are considered fully menopause. In that time, if you have a lot of doubt and problem, actually the main blood test we actually would do or order is what we call the blood estrogen level. The hormone, the primary female ladies hormone is called estrogen, and then the FSH, or the follicle stimulating hormones, which is the priming hormone from the brain to prime the ovary to produce estrogen. So these are the two key hormones level that women specialists, gynecologists will order. Besides that, I think sometimes we are confused or it is possible that thyroid hormone abnormality can also simulate very similar to this perimenopausal symptom, because hot flashes and then, your heart a little bit beating a bit fast, mood changes. So sometimes the doctors will also order thyroid function tests.
Right.
So these are the two kind of blood tests that generally doctors will do if you want to zoom in without just doing a general checkup.
Okay, so just to explain to the clients of the audience here is, in terms of these two tests, is just a blood sample, that's it. Nothing that, there's no excuse for them to say it will take them the whole day at the hospital, isn't it? It's just a
Oh
blood.
yes,
Yeah.
you don't have to come even to the hospital. Some labs will do it for you. Of course, certain lab, they will actually have doctor station there. So
Right.
you just go there. You don't even need to fast. You can go after lunch. You can go before lunch. Don't have to fast 8 hours or 12 hours.
Okay.
Thyroid function test, estrogen, and FSH. They do not need fasting.
Okay, so it's a simple test. And can you explain a little bit more on the thyroid, the two types of thyroid that we are looking at?
Okay, thyroid is actually a thyroid gland is an organ, a bow tie shaped organ around the neck. And generally, it is not very visible for normal people, but it's quite common. Some people, especially during growing age, they can be a bit swollen. So when you get a person to swallow a bit of saliva, then you may be able to see that something move up in the neck. For men, there's an Adam apple, so it's below the Adam apple and on the two sides. Okay, so you do not need to have a swollen thyroid gland to have an abnormal function. The abnormality of the thyroid function can be two-way. It can be too much or too little. It's like when you drive, there is a normal speed level. There are some people who drive very slowly. If I get to my 80 years old or 90 years old, I'll be driving very slow on the road, so too slow. Too slow is called hypo, too low the thyroid hormones. Then hyper is then, you tekan the minyak very hard, so you very fast, that's hyper, or very simple, like, you have hyper kid, so there's too much of thyroid hormone, so the person is very hyper. So it's just very simple, too much or too low, and then there's in the middle, it's called balance.
Right. And when you have the hyper, am I right to say that usually that's where they lose weight and because they're burning a lot faster and all that, right?
That's right. When you are having hyper, even though you eat a lot, you get more hungry, but because you burn a lot, you are like the small kid that's running around all the time, or even if you are not running, but your cell, they are all very hyper, they're all burning, they're all moving very fast, because thyroid is a hormone that regulates the rate of your metabolism. Right. So when you have too much thyroid hormone, even though you are sitting around, your cells are all very, very active. They are all, even your heart is beating faster. Right. If you touch your pulse, if you know how to feel your pulse, your heart is beating faster.
Sometimes the cause of when you think you have heart palpitation, because you are obviously, your heart is actually moving much faster. Is that one of the causes as well?
It's one of the major causes, but a bit easier for you to identify, because when you feel your heart beating, that's called palpitation. Sometimes it's due to the heart beating harder. When the heart beating harder, you can also feel it. Or when the heart beating a little bit irregular, like dub, then so you can also feel it because of the abnormal beating. But in thyroid, it is beating harder and faster.
Right. Okay.
Okay, so this faster, a little bit easier for you, for people who, for the audience. If you are, if you know how to check whether from your wrist or from your neck, if you can feel per minute, if it is less than 80, when you are sitting down, when you're not making any movement, if it's less than 80, is highly, almost can guarantee you there's no hyperthyroid.
Oh, okay. So less than
Almost guaranteed.
okay.
Almost guaranteed. Between 80 and 100, when we say resting, the resting state, which means is you're not moving around. You did not just finish a run, a workout. You have been sitting, say you just woke up from sleep, that kind of thing. Yeah. So you feel if your heart rate at resting is more than 100.
Oh, okay. Still
More
there.
than 100. Okay, pop, 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 pop. So you can use metronome to
Yes.
check, right? Yeah. So if you get more than 100, yes, you can suspect that you might have hyperthyroid, right? Maybe by your own. And then if you have been losing weight and you have been eating a lot and you have been having super energy and you can work like a super mom, a Wonder Woman, I think you are most likely already, probably 70-80% likely to be hyperthyroid.
So, okay, most women wants to be hyper then, for sure, right? So what is the bad thing of being hyper then, right?
Okay. Yeah,
because
that's very important. You may always scold and beat your husband because you have bad mood, right? You have bad mood. You're very short fuse because everything is very fast. So you have very short fuse, right? You eat a lot, and you can't sleep, and also you everything must move fast for you. That is the relationship part, but the body part, your own body, you actually will lose bone faster, probably faster than your menopause time. Okay, even faster than menopause. And actually, if you have to be very careful. I know a lot of women like to, because you can eat a lot and you still lose weight. But yes, but a very hyper, actually, some people can die because of heart failure.
right.
Okay, it's rare, but yeah, it can happen. It's rare. Hyperthyroid is quite common. Okay, thyroid abnormality is quite common in our society because we are a very stressful society. So when you don't have enough rest and relax, actually there's a tendency to get this abnormality in our thyroid function. So more people tend to go hyperthyroid than hypothyroid.
Oh, okay. Oh, I thought it was the reverse. But it's good to know because I know for a fact many women will say, oh, it's okay, I have hyper, that's great because I can eat, I can do a lot more. But this is where what you say is very important, which I want to highlight to the audience is your risk of heart failure or your risk of bone health deterioration actually increases, and we cannot discount even the fact that you will have a more intense relationship with the people around you, may it be work or personal relationship, because you are obviously, like Dr. Dicky said, short fuse, right? So you're not going to be very patient, you're not going to be tolerable to the people around you actually, right?
Likely even to your pet.
Okay. Okay, so let's go about hypo then. What would happen?
Well, the opposite of hypo is that everything becomes slow down. You have very low energy level. You feel tired most of the time, and you need to sleep. And even though you don't eat much, you gain weight, and then you get bloated. You definitely know. I think no women wants it. You will look ugly, because you become bloated, face bloated and body bloated. You get fatter, okay? It's not just bloated as sensation, but it's bloated by look.
Okay. And would this be can this be reversed? What are some of the treatment today that women can take to help them with this issue?
Basically, hypo is like your body do not produce enough hormone. So the easiest way to get around is many doctors will just give you the supplement of thyroid hormone because your gland is not producing enough hormone. is just take a like a supplement, just take a thyroid hormone. That is just circumventing without looking into the root cause of the hypothyroid. But in general, most hypothyroid can be, besides, I suppose, you can have it due to some inactive lifestyle and eating too much, maybe oily food, and you gain weight, so it may cause. But in general, most hypothyroid is due to autoimmune. Right? Autoimmune disease. So, but because it is such a mild autoimmune disease, it doesn't impact other organs. So generally, doctors will not give you immunosuppressant. So in the end, after all the root cause finding, they will just give you a thyroid hormone supplement. So can it be reversed naturally? Well, stress management, relax, mindfulness, please go slow. I think every now and then, there are people who reverse it if you catch it early. And I probably would encourage people to go for those alternative medical treatment, complementary type, where actually they just ask you to take care of your heart, slow down, take care of your pace of life.
Yeah. I'm a big advocate for a natural therapy person, but I also don't want to discount the values or the benefit of hormone replacement therapy, because I know of women who really benefited from this as well. But it's also, I would like to just sound it out that whether you choose HRT or even traditional or Chinese medicine or alternative medication, whatever it is, do note that, like Dr. Dicky said, it's not it's a combination of lifestyle and diet changes, right? And one of the things I want to get your advice is, when a woman actually is confirmed menopause, what are the risks if they choose not to do anything and ignore the deterioration of their bodies? Because that is something that I feel many women are just not aware of.
I think in the East, Oriental people, if we live a very traditional lifestyle, especially traditional diet, I think great majority of people do not feel much about it. There's not much menopausal symptom. So those people, actually, the only thing they would like to watch is that, because most Asian people are small bone frame, I think the only danger is that your bone density will drop quite fast. It will accelerate. It will go to 2 times the speed of loss of your bone density for about 5 years. So if you already started off with very low, so you can quite quickly go into osteoporosis, and probably in your 50s, unlikely you have problem yet. Most people still have very good muscular strength and still live an active life. But this can impact your quality of life when you come to the 60s and even early 70s, when you can have a very trivial fall. You can actually get compression fracture of your spine. You can lose height. You can start having back pain. If you have a bad fall, you can have a fracture of your hip. So it does not happen in the immediate post-menopause, but it can happen in 10 years, 15 years after. So impact, for us now, we want to have an active aging, we want to have a good quality of life. We are talking about 60s is the modern 40s, and it's midlife only when you only cross 80, only you consider your old age. So you don't want something to happen to you when you are in your middle age. Right. So very important point is osteoporosis. And the other thing that you ignore or you try to tolerate is if you have a lot of symptoms, right? Some people can have very bad symptoms with menopause. Okay, so it affects their relationship with their people around, like what Karen has described before. So if you do not take treatment, these are the very important people to take some form of treatment, some sort of replacement therapy, whether it be a complementary natural type or the hormone replacement. In general, now that in the medical community, I believe we are not very pro hormone replacement in giving the actual hormone estrogen because of the health risk related, like blood clot and also certain cancer, you know. But then still, if your quality of life is so much affected by it, that you should not worry about a risk, because a risk is something possible to happen, but you are already having a very bad quality of life that is affecting you, affecting your relationship, affecting your sleep, affecting your mental wellness, affecting your ability to work, to or to take care of family matters. So I think it is a here and now issue. You should not too worry about your 5 year, 10 years risk, right? Risk may not happen, right? Maybe 1 in 100, or maybe 1 in, say, 20. Even 1 in 20, well, doesn't it? I know people buy lottery, people go to bungee jumping. They take risks to have a thrill. But you are just trying to take something to relieve your, or improve your quality immediately. Well, at least try for a month or two, and then you decide whether it's worth to take the risk or not.
Correct. I'm so with you on that as well, because it is true that people they discount the fact that your relationship becomes so intense, and it is difficult for the people around us to understand, and it is up to it's our onus to take care of ourselves first before we can take care of everyone else, isn't it? And I'm so glad that you actually said that, because most women do hesitate, because they think, oh well, I take care of this later, and when later comes and they have lost their friends, or they have lost the social aspect, which I think is another issue, because women need to be supportive of each other, especially when they are going through this. And it's something that I hope with my channel is to bring all these women together and say it's okay to go through menopause, and it's not horrible. And one of the things I want to bring up as well is that when you don't take care of ourselves, yes, at some point when you're 70 or 80, and if you do fall and you break something, you are going to be more troublesome to whoever is around you. And that's why we got to take care of ourselves now, so that we don't trouble our children or whoever the caregiver may possibly be at the time that we actually, fall down and all that, right? So before we go, what are the few advice that you would give to women, especially in their 50s, especially those who don't bother to do their pap smears or breast checks and their, the regular stuff? What would you tell them to get them going, and at least do it at least once every 2 to 3 years?
Yeah, thank you, Karen, for highlighting this. I think it's very good that you organize this, so that people who do not want to talk about it openly can access to this recording and think about it. We are living in the 21st century. We have access to all the information, and now we need to weigh the information and try to have use a scientific method to react to it, because your health is actually in your hand. And if you think about it, sometimes people say that, if I can buy health, I would just pay for it. Yes, when you are still quite well, it is a time to buy health, because the return on investment is the best, the quality is best, and you can enjoy it. So it is this time that you ought to, because in anything, if you capture it early, prevention is better than cure, then you do not need to have very severe, very intensive treatment. For example, if you capture a heart blockage of 50%, 40%, you do not need to go through a stenting, angioplasty or bypass. You just need to take cholesterol medicine, and maybe another additional 1 or 2. Or if you can be very strict with your diet and do your exercise, you can even go scientifically with just purely lifestyle. But the way to go is in diagnostic, we need to test, right? Western medicine is best with diagnostic and can tell you where you stand. Even though it is not possible to early detect everything, but most of the thing now, most of the very dangerous common thing that we can early detect are like colon cancer, breast cancer. If you do screening in the regular interval, you can detect them early enough so that you do not need to take very intensive treatment. You know, intensive treatment, sure, there are worse side effects. Yeah. So you don't like that. I don't like that. And if you ask me, I have done my colonoscopy 2 times because I don't want to be the wellness screening doctor and then suddenly fine day, you know, Karen here, oh, Dr. Dicky Ng had a colon cancer and then had the operation. No, I am setting a benchmark. You know, my patient can ask me, do you do or not? Do you do your checkup or not? Do you check your heart or not? Do you check your colon? You know, so I have done that, you know, and I just want to make sure I can live till a good old age and still running around, still go hiking, still enjoy life.
Yeah, exactly. And that's what we want. It's not about growing old, isn't it? It's having that mobility, the presence of mind, and be strong enough. And then you can be 110 and you're still great, right?
That's right. That's right. Yes.
So thank you very much for your time, Dr. Dicky. And just to tell the audience, please, if you're ever in Penang, you can visit him at the Adventist Hospital. Great person, and he will always tell, he has the best patient relationship ever. So thank you very much, Dr. Dicky.
Thank you, Karen.
Bye.
Bye-bye.